Hi, everyone. Thanks so much for joining. We've got a lot to cover today, so we are going to dive in. My name is Jen Wagner, and I'm the Director of Medicaid Eligibility and Enrollment at the Center on Budget and Policy Priorities. Welcome to this month's Elevating the Medicaid Enrollment Experience, Renewals 202. This is a follow-up to last month's presentation on Renewals 101 that kind of introduced policy around Medicaid renewals. Today, we're going to take a deep dive into improving renewals with a focus on the ex parte process. And today's format is going to be a little bit different than usual. I'll go through a couple of slides and spend maybe half of the hour talking about the ex parte process and diving into areas to focus on to improve the process in your state. But the rest of the time, we'd really like to have as a discussion to hear from you all as far as what the challenges are in your state, where you've had successes, where there's still room for improvement, and to answer any questions you have about the policy, about the technology, about how to approach the issue. So please be ready to be engaged and share what's happening in your state. The chat is open throughout the presentation, so if you have any questions, please submit them and we'll cover those at the end as well. But then we look forward to hearing from you in the second half. So let's go ahead and get started. So today we will do a brief overview about policy around Medicaid renewals and the ex parte process. But then the bulk of the time, we're going to really dive into what qualifies for an ex parte renewal. The concept is pretty straightforward, but how it's implemented in states varies considerably across different states and is a huge area of advocacy in order to improve those ex parte rates. We'll talk about obtaining data and design documents to figure out what's happening in your state and talk through a couple of principles and different scenarios that are going to be important to implement if you're looking to improve the ex parte process. And as I mentioned, that last part of the agenda will be a discussion, questions, and hearing from you about what's happening in your state. So first, let's start with a quick poll to gauge where you are in this process. When we're talking about Medicaid renewals, what's your level of engagement? Are you still learning the basics? Are you looking to have conversations with your state and getting started? Are you already engaged in those conversations? Or are you so deep that you see design documents in your sleep? I'll have to kind of check in the fourth box here and see if I have any other friends who are deep into this issue. So please go ahead and select whichever one's most applicable for your situation, and then we'll be able to kind of gauge how the audience is today. All right, thanks for participating. How are our results looking? Okay, great. I'm hoping you guys can see this as well. About 55% of people are still learning the basics. 23% are looking to have conversation with the state. 15% are already engaged in conversation. And 8% see documents in your sleep. All right, these are my kind of people. All levels of this are, welcome for this conversation. We're thrilled to have you and look forward to kind of, helping you engage more with your state on how to improve this. So let's dive in with a few basics around Medicaid renewals and the ex parte process. So just a reminder that Medicaid renewals are required every 12 months for the MAGI population, pregnant women, parents, children, newly eligible adults. For the non-MAGI, for the elderly and disabled population, it's required at least every 12 months by the federal regulations. Many states have a 12-month interval, but some unfortunately renew more frequently than that. Again, according to the regulations, a state must attempt an ex parte renewal using available data sources before requesting information from the beneficiary. So one of the key things to think about in this conversation is terminology. So the regs use the ex parte process, the phrasing of ex parte. And when we say that, what we mean is a process that does not require enrollee action. They don't have to do anything in order to continue receiving Medicaid. States use other terms for this process. They might call it an automated renewal, a no-touch, administrative. I believe North Carolina has started using straight-through renewal, whatever works. But it's good to really understand what your state calls this and what they mean by it. We've seen some states that say, oh, well, if we can't renew based on the data sources, the system sends out a paper renewal process that people have to return. That's automated. No, it's not. That's not ex parte. Yes, there's some automation involved, but that should not count as ex parte. So be sensitive to what term your state uses for this context and really what they mean by that. So when the state looks at those data sources, if the data sources confirm ongoing eligibility, the enrollee is sent a notice with the basis of determination, and they only have to respond if updates are necessary. Fundamentally here, though, if no action is taken, the enrollee is renewed and continues receiving benefits. If the data source doesn't confirm ongoing eligibility, then you kind of fall back to a more traditional manual renewal process. The enrollee is sent a pre-populated renewal form. They must be given at least 30 days to return it. They must be able to renew by mail, phone, online, or in person. And if that renewal is not successful and they lose coverage, if the enrollee seeks coverage again within 90 days during this reconsideration period, they must be re-enrolled without having to file a new application. But fundamentally here, under this manual traditional process, the enrollee has to respond to continue coverage. And once we have this process where paperwork is sent out, the enrollee has to receive it, has to understand it, has to send it in. The state has to process it timely. All of those things are a lot of opportunity for problems. And that's why we really want to focus on the ex parte process and using these electronic data sources to renew those eligible so they don't lose coverage for procedural reasons. They may remain eligible, but if they don't get the form, send it back in, et cetera, they lose coverage and churn back out of the program. So for those visual learners, this just kind of illustrates the process a little bit. The agency checks data sources. If those confirm ongoing eligibility, the beneficiary is notified but doesn't have to take action. If it does not confirm ongoing eligibility, they're sent this pre-populated form that they must return in order to continue receiving benefits. So now we come to kind of the crux of the issue. What does it mean to confirm ongoing eligibility? What does it mean for the data sources to show ongoing eligibility? And here we have kind of a spectrum with states falling all along the spectrum, and where they fall along the spectrum influencing their ex parte success rate. How many of their cases are actually automatically renewed versus having to send in a form. So on one end of the spectrum, we have states with a more conservative policy, and they tend to kind of require an exact data match for each income source on the case. So only if the person is at the same employer, has the same type of income, and all of that income can be verified electronically, and all of it is consistent. There's not much variation. Only then do they renew a case ex parte. On the other end of the spectrum, we have states that don't really worry about what's currently on the case, but look at the data sources. And unless the data sources indicate ineligibility, they renew the case. So only if they see income that added together is over the eligibility threshold, that's the only situation in which they kick a case into the manual renewal process. Otherwise, they're going to go ahead and renew it. So it's good to kind of think about it and understand where your state falls on the spectrum and the approach that they've taken. Now, there's a lot of variation in how many cases a state renews through the ex parte process. This is taken from the 2020 Kaiser 50 state survey and gives an idea of where the different states land on this spectrum. You see a number that still have not implemented ex parte renewals. That's a problem. It's in the regulations. It's been there. It's been since 2014 that it's been required. So that's the main point of advocacy, to make sure that that's happening in your state and that it's happening well. Sometimes it's actually easier to build it correctly from the ground up rather than go in and try to make modifications. So there's arguably an opportunity there. But for the other states, you'll see that they range from fewer of 25% of their cases renewed ex parte to greater than 75%. And this really reflects the choices that the state has made. There's not this much variation in the Medicaid population across these states. It's up to the state decisions about how they program their eligibility system and how they've chosen to implement the ex parte process that says where they fall on this. This is an incredibly valuable and useful survey, but I just want to point out that it is based on state responses and their interpretation of automated, even though Kaiser says completed without enrollee action specifies what they mean, there is variation in how the state reports this. So you might find that this doesn't precisely align with what's happening in your state currently. However, it's valuable to see, kind of where on the spectrum you might fall and to know that there are a number of states that renew over 75% of their cases ex parte. So a high rate is possible and can be achieved. Before you dive into this process, a few things to consider. For one, in many cases, the ex parte process is actually in the eligibility system. It's not something that usually can find in a policy manual or the administrative code. It was programmed into the system oftentimes around 2013, when your state may have implemented a new eligibility system or programmed MAGI rules and everything associated with ACA. And at that time, much of the focus was on getting MAGI rules right and on the application process, particularly if you expanded Medicaid, making sure that everyone has a streamlined process to actually enroll. And so the ex parte process and the renewal process as a whole didn't get as much attention. And in some states, it's been nonstop crises ever since then. And so these rules may not have been revisited. And so in many cases, this process is a little bit under the radar. People aren't looking at it regularly. You can't see it in the policy manual. And so no one's actually torn this apart to see where improvements are possible. And that's an important role you can play to kind of bring it to the attention of the agency. Another consideration is there's not very much detailed guidance on this from CMS. There are a few Q&As out there. There are a few scenarios that they went through on the ex parte process, but in general, they haven't gotten deep into, okay, if the case shows this and the data source shows this, what do you do, ex parte or not? What are the parameters you have to do? Now, on the one hand, that gives states a good deal of flexibility to set their own policies. On the other hand, states may be hesitant to take forward-looking action without CMS giving an express okay. And finally, it's important to consider that here there's a strong state interest in improving the process. This isn't about expanding coverage or doing something that might create political backlash. This is really about efficiency and saving caseworker time from both processing manual renewals and from processing reapplications from folks who lose coverage at the renewal process, though they remain eligible. It might seem a little bit strange to talk about renewals right now while the continuous coverage provision is in effect, because states are doing renewals a little bit differently, and fundamentally people aren't losing coverage if they are unable to complete a renewal. But it's actually a critically important time to talk about renewals and specifically about the ex parte process. On the one hand, the more cases states are able to renew ex parte right now, the fewer that are going to be in the backlog at the end of the public health emergency. So we expect that the public health emergency will last through this calendar year and likely into January of next year. But at that point, states will have a lot of overdue renewals and have to take those on and stagger those out and get through them. But if they're able to renew cases ex parte in the next couple of months, they're pushing those cases forward and they won't be part of the backlog immediately and overdue at the end of the PHE. So this is an important time to look at the ex parte process. In addition, at the end of the public health emergency and when that continuous coverage provision ends, the states are going to have a great deal of workload. They're going to have a lot of cases to get through. And the more of those cases that they can do through the ex parte process, the less they'll have to do with caseworker intervention, sending out notices, fielding phone calls, and all of those things. So it's actually a really important time to take on this issue. All right, so what's happening in your state? Again, it's something that's kind of under the radar and hard to learn exactly how things are programmed and what the results are. So the first step, if you're going to look into this, is to actually just request data on the ex parte success rate. And the fundamental question is how many cases are renewed without the enrollee having to take any action. That may or may not be consistent with what they reported on the Kaiser survey. And that would be great to know what the true success rate is or how the state frames it. But for those cases that can't be renewed ex parte, why not? Why do cases fail the ex parte process? In most cases, we think it's going to be around income verification. That's the most common place where cases fall out and have to go to the manual process. But sometimes there are surprising reasons. Sometimes there are issues with Social Security number verification or a pending action on the case or other things that make it kick out of the ex parte process and require that form to be sent back and forth. So it's great to know that, to kind of focus your advocacy and know where you can make the greatest impact. The next step is to actually request those system design documents. Design documents is how most states refer to the details of how the eligibility system is programmed. So in most cases, state policy staff and vendor, whether Deloitte, Accenture, Curum, or even in-house staff, sat down and said, okay, if the case says X and the data source says Y, this is an ex parte renewal. This is not. And laid out all those different scenarios that determine whether a case is renewed ex parte. And those are memorialized in these design documents that basically tell the programmer how to program the system. But that's where these details are found. And that's really the best way to understand what your system is doing and identify areas where it's being too restrictive. And you could kind of promote policy changes that would open that up. So let's take a look at a few examples. So our friends in Pennsylvania have gotten into this issue and request information from their state. They got this data back that shows all of the ex parte process, how many are successfully renewed, and why they fail. But they learned something really important by requesting this data. The main thing they learned is that only a small number of cases are actually eligible for the ex parte process in Pennsylvania. So the first number is over 3 million renewals that are due each month. And granted, this includes cash and SNAP cases that can't be renewed ex parte. But all those renewals that are due in a month, they only allow Medicaid only qualified cases to go through. So if the case has SSI, if the case also has SNAP or cash or general assistance, they're excluded from the ex parte process. And so separate here from the success rate of the ex parte process, they realize that the state is excluding huge numbers on the front end that don't even get to try to go through the ex parte process. And so that kind of directs their advocacy in that direction. Rather than necessarily fiddling with the detailed design documents, they start a level higher, saying, why can't Medicaid cases that also have SNAP, that also have cash, go through the process? And it's harder. It legitimately is harder if there are other programs on the case, especially in an integrated system. But it's possible, and that's kind of an area of attention. The other thing I want to point out is that if we would go back to that Kaiser 50-state survey, they report that the Pennsylvania reports that over 25% of their cases are renewed ex parte. Here it shows 23%. Maybe this is a different month, whatever. But fundamentally, it's 23% of Medicaid only qualified cases. So the denominator here that Pennsylvania is reporting on is very small versus all of the Medicaid cases that could potentially go through the ex parte process. And so that's why this level of detail can be really informative. So that's an example of data. Here we've got two examples of the actual system design documents. So this one is from the Illinois Integrated Eligibility System. And it's hard to read. You're not expected to kind of follow the detail here, but it essentially says, okay, if the medical case has earned or unearned income on the case and the data source returns a higher income result, here's what you do, here's what you do. And so I kind of summarized it. If there's income on the case and higher income in the data source, but still eligible, you renew. However, this third one down, it says if there's earned income on the case, but there's no earned income in the data source, they can't renew. Why? Presumably they lost a job, but this is an area maybe to focus on, that the Illinois system excludes these cases from the ex parte process. So many of these design documents have a few pages where they go through these detailed scenarios, and you can understand how the system is actually programmed and what cases go through and what don't. Here's an example from Missouri. Again, lots of kind of detailed words here, but at the top it's summarized. Missouri triggers a manual renewal or excludes from the ex parte process anytime the attested income or the income on the case is 0. If the income sources don't match or the types don't match, or a case moves from non-premium to premium. These are all reasons in the eligibility system to go to a manual process instead of the ex parte process. Some are necessary. You can't renew everybody ex parte, but some might be an opportunity to tweak things or change things so more cases can go through the ex parte process. So really kind of the meat of the issue and the way to really figure out what's happening in your state. Another consideration with improving the ex parte process is what data sources is your state using. So the more data you have that can verify what's on the case or verify the income, the more likely the state is to feel comfortable moving forward with the ex parte process. So one thing to look into is your state using Equifax, the work number, also known as TALKS? Do they have access to that? It is available through the hub if the state is going to the Federal Data Services Hub. However, if you have an integrated state that also has SNAP or cash mixed together with Medicaid, then you can't use data from the hub for other programs, and some states may not take hub data. And so you may not have access to this valuable source that can verify earned income. Another key opportunity is SNAP. You can use data from SNAP. You can use the fact that somebody is enrolled in SNAP through express lane eligibility or through the state plan option to renew Medicaid. You can push forward Medicaid when you do a SNAP renewal. For those combined cases, there are a lot of opportunities to leverage the fact that SNAP generally has more recently verified and more thoroughly verified income that can be used for SNAP. And that applies, by the way, if you have an integrated state or have SNAP and Medicaid in separate systems. Different strategies are easier depending on what state you're in, but SNAP is a very valuable data source. Worth asking about IRS data. IRS data is complicated, it's old, yearly, has lots of security requirements, but it can be useful for some self-employed individuals. It's worth asking whether your state uses it and how. Not to say that that's going to magically increase your ex parte rate, but that's something good to know about. Do you work in a state where a lot of folks work in another neighboring state? Are you able to access quarterly wage data from that state to verify income? It's another opportunity that might be able to help your ex parte rate. Also, when we're talking about data, what's the hierarchy? For certain employers, that income might be found in multiple sources. It might be in the state's quarterly wage data, and it might also show up in the work number. So how is the system programmed? Which of those numbers does it take and actually use for the ex parte process? Not necessarily one right answer or the other, but it's good to know and good to make sure that you're not double counting income. So if somebody's working at Walmart and that shows up at both sources, that the state chooses one to use and doesn't use both of them and kind of combine those incomes, like double count that income and make people appear ineligible who otherwise would be eligible. The next thing to consider is kind of general principles and how the state and how the system approaches ex parte renewals. First of all, they should only be re-verifying factors that are subject to change. And this is primarily income. They should not be re-verifying citizenship or immigration status. They should keep the process at the renewal much narrower than it is at application. Along those same lines, they should assume that there's no change in household composition or tax filing status. There was guidance from CMS on this years ago that directed states to assume no change. There is no electronic data source for household comp and tax filing status. Even IRS data is a little fuzzy in this area and old. So if a state is going to say, we must re-verify this for every renewal, nothing can be done through the ex parte process. So make sure that they're not being unnecessarily restrictive there. Also, the state should not put unnecessary restrictions on the age of data. Yes, you want more current data that more accurately represents a client's circumstance. But some states say that you can only use quarterly wage data that's 2 months old or something silly. Well, it's April right now. The state has access to the October to December quarter. Sure, that's not the most current, but if that shows the same income at the same job, it should be used. You know, quarterly wage data by definition is a little bit delayed. And so if a state says, oh, only if it's X months old can it be used, that's silly. And just keep in mind, this applies for the next one as well, the ex parte renewal process can only be used positively. You can only renew a case ex parte. You cannot terminate a case ex parte. So if the data suggests that someone's not eligible, they don't lose coverage. They take to the manual process. And like we said, the manual process has a high risk of procedural issues getting in the way. However, it's still the regular process. If the data aren't right or something's changed, the client has a chance to send that renewal form back with documentation. And so it's good to use data, even if it is a few months old. Similarly, the state can assume a worst case scenario for certain things. For example, some data sources might show that there's some sort of a garnishment, some sort of a recoupment, whether it's on Social Security income, unemployment, something else. And a state may, in a well-intended way, say, I don't know if that garnishment should be counted as income or excluded. So I'm going to kick it to the manual process so a caseworker can look and make sure things are accurately counted. But remember, one of the beautiful things about Medicaid eligibility is that it's on or off. So whether you're at 10% of the poverty level or 110% of the poverty level, you're eligible. So we don't necessarily need to refine things to that level. So program it for a worst case scenario. Assume that that garnishment is countable. If the case has a few deductions on it, assume that there are no deductions at renewal. That's fine. In most cases, those are kind of small amounts that don't fundamentally change the eligibility of the client. So if you kick the case out of the ex parte process for these reasons, you're in the manual process. But if you try to renew ex parte by assuming the worst case, in many situations, the case will be renewed ex parte. And worst case scenario, it's kicked into the manual process, at which point the client has a chance to demonstrate and prove these different detailed income factors. So that can take some of these tricky cases and make them ex parte rather than defaulting to the manual process. Now there are some tricky case scenarios that an eligibility system has to deal with. First of all, for cases with no countable income, CMS, we believe, has directed states that you cannot ex parte a case if there's no countable income, if there's no hit in the data sources. We're concerned about that. We believe that's unnecessarily restrictive and takes a huge portion of the Medicaid population, many of whom is exceptionally vulnerable and has no income, and puts them at risk of losing coverage by having them go through the manual process. So that's something we're working with CMS on, but something worth talking to your states about. Sometimes there are employment changes. People were working at one job when they applied and a different job at renewal. That's going to be even more common when the public health emergency ends and these cases are touched for the first time, not just in 12 months, but in multiple years. Okay, so if the person was working at McDonald's and that's no longer showing up in the electronic data, and now it's showing at Burger King, Walmart, whatever it might be, don't worry about the fact that the employment has changed. Look at the current income and see if that makes the household eligible or not. There's also a whole set of income that can't be electronically verified. This could be rental income. This could be interest income or pension, things like that. So again, ex parte can only be used positively. So what would the state be comfortable with? Maybe they can assume a small increase, by some inflationary factor each year. Or you can allow ex parte if that income is below a certain threshold, like $100. You'd hate to see a case that has $16 in interest income excluded from the ex parte process because they can't verify it. Assume it's $50 now. Whatever, in most cases, it's not going to affect eligibility. So there's an opportunity to kind of craft it where if the case is not close to the eligibility threshold, you can go ahead and renew it. Now, another really tricky situation is where the electronic data indicates that the household is still eligible, but they're now in a case, in a category with a higher premium or cost sharing. And so this is a tricky situation that's worth discussing with your state. On the one hand, you're kind of using this electronic data in a slightly negative sense of giving them less valuable coverage. And so that might be a reason to kick to the manual process so that you can have a more refined calculation of income and make sure that they're in the correct category. But on the other hand, anytime you kick to that manual process, there's such a high risk of eligible individuals losing coverage. And so you could say, fine, go with the electronic data, put them in the higher premium or higher cost sharing category. And then when that notice is sent to the client that says, you've been renewed based on this information, if anything's inaccurate, call us. That gives the client a chance to come back and prove what their exact income is and possibly switch them back into another category. So there's some tricky balances there, but it's worth looking at what your state does and considering what might be ideal. Finally, let's not forget about non-magi, elderly disabled households. Ex parte is required for non-magi as well. However, they're often overlooked. But there's a great opportunity to use ex parte for this population because generally they have very stable income and it often can be electronically verified, especially if it's primarily Social Security. What has gotten in the way previously for most states is the fact that there is an asset test in most states for this population. However, there's a somewhat newish asset verification system that states have implemented that allows a state to check against local financial and national financial institutions to see what the balance is in the asset account. Just in case the old lady happened to win the lottery in the past year, you could find that out through the asset verification system. But that's something that will kind of take away the excuse from the state in saying, oh, we can't do ex parte for non-magi because we can't verify assets. Yes, they should. Yes, they can, and they should be prompted to make sure that non-magi is included as well. All right, so that was a brief overview of ex parte and some of the points of advocacy. But now we really want to hear more from you. So as part of this discussion session, we're going to start with questions. So is there anything you guys want to ask for clarification on, or that you have a specific question on? If so, feel free to unmute and raise that, share it in the chat or the Q&A. And then we're going to talk a little bit about your story and what you think the biggest challenge is in your state. And finally, we'd like to know what would help, whether it's advocacy at the national level with CMS, or whether it's papers or research or sharing experiences across states. Whatever it is, we're eager to support you in this process. So let's start with questions. Feel free to turn. Yeah, go ahead.
This is Ann Swerlick from Florida Policy Institute. I know that our agency seems to have trouble using electronic verification for VA income. They seem to get hung up on that. And I'm not quite, and I know there's been a lot of advocacy pushing back, not on our part, but others to try to get them to do that. And there's a whole VA, I think, system that they might be able to plug into. Have you heard anything around that?
No, I haven't heard that specific issue raised, although I know that that is an available data source that they should be using. I think that actually comes through the hub, but there are other ways of matching, possibly through the Social Security Administration. So I'd be happy to kind of dive into that with you, but I know that there's an electronic data source for VA income, and I don't know if there are limitations to it that kind of constrain states, but that should be something. It's a government benefit that should be electronically verifiable.
Okay, great.
Melissa, we received a question in the chat. Is there a standard or expected way that states should be tracking and reporting ex parte fail reasons?
Great question, and unfortunately, there's not. The CMS does actually require some sort of tracking of successful ex parte. In the performance indicators that they require states to report to them, it does have an area for this. Unfortunately, CMS does not make that public, so we can't see what they're reporting, and it's really kind of success not. There might be a subcategory there for procedural denials versus finding of ineligibility, but fundamentally that level of detail of like, okay, the cases that fail the ex parte process, why? What are the reasons? And that could give you some information that's not federally captured right now.
The next question is, have you ever seen data about the question of gender on Medicaid applications? The fact that some states recognize third gender markers, which can't be verified through SSA sometimes, can bring up errors in the verification process. So is gender required to be verified in Medicaid applications?
That's a great question. I had not heard that come up before. Part of me is saying like, okay, is it a factor subject to change? Well, the reality is now to some extent it is, subject to change, but there's no reason to have to re-verify that at renewal. I know that can affect what type of benefits are offered to the individual depending on that, but and I could see how that's a conflict. What I'm thinking about with the verification process is, should they even be pinging SSA data sources to verify that? I know at application, as they're verifying demographics, like name and social security number, that's one of the factors, gender is one of the factors that goes back and forth to make sure that it's the correct social security number and the correct name and birth date, that all matches. But those are not things that should be re-verified at renewal, and therefore it should not trigger like a mismatch at renewal because you shouldn't be re-verifying social security number. So that's a great point, and it'd be super interesting to figure out in your state how many cases actually fail for this reason, and how do we kind of get underneath it.
I have a question. I don't know if we're hand raising or what. Here's my hand. Hi, thank you. I didn't realize Massachusetts was so bad on the ex parte data. I don't remember seeing that. So we've had a horrible time trying to get data out of our state. And when I finally got the right name to ask for the business requirements document, this was a while ago, so the details are a little fuzzy, but I think they pretty much said it would be a huge security breach and they would have to spend hours of lawyer time reviewing it to redact information that hackers couldn't use to access their system, and it will cost thousands of dollars for us to do that. And I did a little checking around to see if this was plausible. Some people thought it was plausible, depending on what's in these documents. So I kind of gave up. But I would love to get that because it's been really, really hard to get. When we do a standard record request, we don't get very much out of them. And we've discovered a few kind of egregious errors over the years, but sort of accidentally.
Great question. And states have had different levels of success in getting those design documents. Like I showed in those examples, advocates in Illinois, in Missouri have gotten them that speak to exactly how the system is programmed. Others have gotten pushback. Louise wasn't able to join today from Pennsylvania, but she got similar pushback to an open records request. And oh, it's going to expose all kinds of data. So the kind of compromise was that the state produced documents that gave her the information she needed without revealing, mysterious secret data that is, subject to all this protection. So perhaps rather than redacting, if there'd be a possibility of having a conversation to say, this is specifically what I'm looking at. Can you cut and paste the part of the design documents where it says, here are the different scenarios and here's the expected outcome. You don't need screenshots. You don't need detailed programming. So there is a way around it. To me, that strikes me as a very lawyerly, obstructionist type of response because they don't really want to engage in it. There is a way around it. You need to kind of get them to pursue that and to try to make it work because there are definitely possibilities.
And a follow-up question on ex parte fail reasons. If no standard or expected ex parte fail reason reporting, if there is no standard expected ex parte fail reason reporting, how are advocates learning of these within their states? And in California, they just get scattered or anecdotal reports, and they're wondering if they should be pushing for something better and more comprehensive.
Yeah, it's definitely challenging. Again, the ideal would be that at the federal level, that CMS requires that it's somehow publicly available and that we can shame certain states that are, not doing it well and highlight states that are great. So there's some potential for that right now and something that we are advocating for. But in the meantime, it really is state level advocacy to see, first of all, it's always interesting to know if the state has this report. Is this being produced? Is anybody looking at it and paying attention to this opportunity and how well the state is taking advantage of this policy? But if they're not, can this information be generated? And how might that happen? So some states where the advocate has a good relationship with the agency, they've kind of gotten into this together and produced some reports. Others have gone through more of a legislative angle to require something. That's part of how some of the Illinois information came to light, is that there was a legislative task force or mandate or something around the ex parte process that forced a report out of the state identifying these reasons and identifying areas of opportunity and things like that. So I think it's like any other time that you want to get data, is use all those different tools in your toolbox to try to get the state to both generate it, look at it, and share it with you. Other questions? Okay, so now we want to just do a quick poll because I'm curious, what do you guys think are going to be the biggest challenges if you take this on in your state? So do you think the biggest limitation is going to be actually getting the data and the design documents? Is it going to be convincing the state that is a problem or an opportunity to improve? Is it going to be fundamentally bandwidth? There's so much going on, especially with COVID and all the other things. Even if they want to do this, they just don't have the capacity. Or is there something else that's going to get in the way? All right, so what are the biggest barriers that are out there? Take a look. Okay, so not terribly surprisingly, 37% say getting the actual data and design documents are going to be the problem. 27% say convincing the state that is something that should be worked on. 29% say bandwidth, and 6% say other. And Melissa's chiming in to say that, you know, all three have been an issue in Texas. I know sometimes when we identify barriers, making you choose just one is a little bit challenging. So it looks like it's kind of a decent spread across the three different possibilities. So for folks that have worked on this a little bit in greater detail, what have you experienced? You know, what are some of the areas where you could use some help with, or areas that you've had success in that you want to share with other states? We'd love to hear from you.
I can speak a little bit about what we've been doing in Texas. So we have an administrative renewal rate of 9%. That's the data behind the Kaiser Family Foundation's table. That has been confirmed by our state. We thought we had a big opportunity in the summer. Our state was one of the states that started a little early doing renewals during the public health emergency. And at the time that they did it, they actually had over 800,000. We have 4 million people in Medicaid. So we had over 800,000 people who needed to be renewed all at once. And in the managed care organizations, we're interested in more of those passing through the administrative renewal process because they were tasked with outreach for those who didn't. So we had a great coalition of folks pushing for this, whereas before it really was just the wonkier folks like myself and every Texan. And we got some good data. We got a lot of good information from our state. We know the thing that Jen mentioned earlier, our biggest hurdle is the income that we're one of the states that for some ridiculous reason, we have a 60-day window to use quarterly wage data. That means 4 months out of the year, it's usable. So if you're trying to renew somebody with earned income in any other month, it won't work in Texas. We no longer use the work number system because it was shut down in October of 2019 for being too expensive. So our biggest hurdle has been just, I don't want to say political will. I think that gives it maybe a different tone than I mean. It is fear of upsetting the status quo. The decisions that were made in 2014 were made under different leadership. We had a different commissioner. We had a different state Medicaid director. We had a different person running this department. And so no one that's there made the decision, and no one wants to put their neck out and unmake it, even though it's clearly standing in the way. They've openly said it's the biggest problem for our administrative renewals to work accurately. So that's sort of where we're stuck. And I will say they seem really stuck on the 60-day timeframe because they believe that aligns with SNAP. So we've pushed a lot on that. Yeah, we've pushed a lot. Oh, and they'll quote an audit done. I have to remember what year. It's something ridiculous. It was way before I was even doing this. So I want to say like 2010, maybe there was an audit done, and we actually went back and I read through, it was like 400 pages to figure out what they were looking for. And it actually was saying that it was actually asking for increased use of electronic data for verification of Medicaid. So we've done everything we can, but again, I think the biggest sticking point is just willingness of the leadership to undo a decision that was made under different leadership. We're hopeful that all of this spotlight will move it, but so far they haven't changed the system.
Thanks so much, Melissa. It's always good to hear how those things kind of play out on the ground. And Melissa's fighting the fight in Texas, Anne's fighting the fight in Florida. Like if they're doing it, we all can. But you brought up some interesting points. One is the managed care organization. You know, when we talk about renewals, when we talk about churn, generally the MCOs have a very strong interest in making things work. They want to keep those individuals. Sometimes if they fall off and come back on, they can enroll with a different provider, continuity of coverage. There are all kinds of reasons where they want to retain those individuals. And so sometimes that's a partner opportunity, whether it's getting them to pressure the state, go public, you know, whatever it might be, they can be a good partner here. And the other thing that you brought up that I just wanted to kind of dive into for a moment is this issue with the work number. And just a reminder, what the work number is, it's a commercial database that provides very recent employment information for certain large companies. Generally, it's companies that use ADP as their payroll processing. Those companies kind of dump all of their payroll data to Equifax, and that's made available for a high cost to various agencies. It's incredibly current. I'm pretty sure that today it would show what somebody's going to be paid tomorrow. It is that current, much different than quarterly wage data that's months old. It's limited to folks that are, in these more larger companies, but it allegedly covers around 50% of employees in the country. So, hey, if it's in there, great. And the feds did something great by contracting with Equifax to have that available through the Federal Data Services Hub. The problem, though, is that any information that comes through the hub can only be used for Medicaid. So in a state like Texas and others where there's an integrated eligibility system, they generally have one income field. And so you can't say, oh, here's the income I'm counting for Medicaid, but when I'm calculating SNAP eligibility, I have to forget that and verify it separately. You can't have that conflict. You can't have those different sources. And so some states like Texas have stopped using the hub or never started using the hub and choose to get that data from kind of individual connections to Social Security Administration and others. Doesn't get the efficiency of the hub, but not a big deal. For the most part, they still get the same Social Security data and other things. However, specific to the work number, they usually have to have a separate contract with the work number and pay per hit. And that can be prohibitively expensive. And so a lot of states just don't use the work number at all. They don't go through the hub and they don't have a separate contract because of the cost. Another thing we're trying to work on at the federal level, I know FNS for SNAP is actually has some demonstration pilots where they're going to be funding some states use the work number. So this is something that's, that the feds are aware of, and there's some efforts around here, but it can be fundamentally limiting. Vicki, did you want to add to that?
I just wanted to ask, because we'd inquired about the work number before when we heard it was available through the hub, to find out why our state, which is a separate Medicaid agency, it doesn't decide things with our welfare agency, wasn't using it. They said it's not free, that it may be available through the hub, but the states have to pay for it. We do have an integrated system with our state-based marketplace. Would that make it cost? I don't know. We inquired. There seemed no reason not to do it if it's free, but they were adamant. This was a few years ago that it was not free. Maybe available, but not free.
That's super interesting to know. I have never heard that. Everything I've ever read or conversations I've had suggests that it is included in the hub data. At research, they use the RRV, Renewal Reverification Service, or something like that, that collects that information and sends it to the state, whether it's for Medicaid eligibility or exchange eligibility. And the hub is part of that. So that's helpful feedback. And as we kind of dive into it with the new administration more on, where there might be opportunities to make the work number more available, we'll definitely inquire about that.
And I'll check again. This was a few years ago when we first heard it from you guys, I think, that they could use it, and they said they could, or they could, but it would cost money. Okay.
It's always so helpful to see what excuses the state provides to not doing certain things. I mean, some of which are valid and complicated at the state level, some of which are just a little suspect. Other comments, questions, or experiences that folks want to share?
I'm in California. Such a great webinar. Thank you, Jen. In California, we recently got the asset verification program out here, asset verification system. Our state to confirm they will start using that for non-magi ex parte. We have failure across the state to do ex parte pretty much at all for non-magi cases. So we consider it a step forward. At the same time, the state has said, oh, but the asset verification system data, that's not enough for us to do ex parte on assets and resources because it isn't a complete picture. So that's just a challenge that we're going to have to overcome. I don't know if anybody else has dealt with that. Thanks.
Yeah, thanks for raising that. We actually are working on a paper on AVS, and we'll have that out hopefully in the next couple of weeks, and intend to do a future Emmy webinar focused on non-magi, streamlining in general, as well as how to use AVS in renewal. it is accurate that AVS gathers information from financial institutions. So it shows like bank account balances. It doesn't show life insurance policies, stocks, and other things. Some states use an AVS. They have an AVS that includes data from like Lexus or TransUnion that might show like real property ownership. And so that provides a little bit more of a comprehensive picture of an individual's countable resources. But there are certain things that fundamentally can't be verified. My take on it is I have a bit of sympathy at application, that you might need to verify life insurance or certain things at application. But the idea that somebody that you've kind of proven is low income and has limited resources somehow acquired a significant amount of resources within that past year. And if they did, that they're going to just put it on a renewal form and tell you all about it, even though you can't electronically verify it. Like, that doesn't really kind of make sense. And that doesn't really favor the balance of not allowing non-magi to go through ex parte and requiring everybody to fill out a manual for it. So I think that's really worth diving into. We've heard, yes, AVS is limited. It doesn't do everything, but the state has a lot of flexibility here, and they don't have to be that restrictive in this area.
We received a comment in the chat regarding the work number. The work number poses a problem for organizations because there is a charge. Employees or former employees can obtain the information for free most times. The Medicaid program in their state states that clients can provide a written statement giving 3 incidents where they try to obtain the information. But this is always a problem for their clients trying to get information from the work number.
So this is a great issue to raise. So when we refer to the work number, we generally refer to it as an electronic data source that the state can access in order to verify income. But from my understanding, the origin of the work number is that a lot of larger companies got tired of constant inquiries to HR about people who are applying for public benefits, who are applying for mortgages, and constantly having to verify income of individuals. And so they contracted with Equifax to establish this database. Now that database is valuable for banks and state agencies that use it and that access it to kind of directly verify income. But one of the side effects is that in order for those companies' HR to truly save time, they don't respond to inquiries to verify wages. And they tell the individual to go to the work number and obtain the information from there, which is another hardship for the individual and kind of a runaround there. So, the ideal solution is for the state agency to be accessing it directly and cutting the client out of the circle, because they can, do it more quickly, more accurately, without that risk of procedural denial. But that is certainly a problem if the individual is being directed to the work number. And I wonder if there are other verification sources that they can provide of pay stubs or other things, although I know that's kind of increasingly difficult with an electronic age where you don't necessarily have that paper pay stub in hand. So thanks for raising that issue. I would suggest that in your state that the push be for the state to directly access the work number. Other comments, thoughts, stories, questions, fun facts?
I am just curious what the approach might be at the federal level. I think I have this general frustration with administrative renewals in Texas because it's required to do it, but they're doing such a poor job of it. So to say you're required to do something and then they do it less than 10% of the time, just big picture, immediately they want to kind of go in the weeds on, well, why that happens. We've got to make sure program integrity, blah, blah, blah. But just what might be an approach for the actual, Biden administration on, just better monitoring of something that is required when it's not working 9 out of 10 times.
Yeah, I mean, we're going to be pushing CMS to take a number of actions in this area. The first is accountability. So for states that aren't doing it at all or are doing it kind of joke amount of times, something ridiculously low, to push them. This is in the regulations, they're not doing it well. Another angle is just data reporting so that we know who's doing what and where some of the problems are. Another thing is to reverse that guidance on zero income cases. So that can be really renew as many people administratively as possible. They're really constrained because obviously, as we all know, zero income cases represent a good chunk of the Medicaid caseload. So that's a point of clarification. Another thing they can do is just provide guidance, provide details about all these different scenarios and what action the state should take, what action they can take for states that really want to improve this process, so that they have comfort that CMS will not come down on them for being too lenient. And there's a lot of messaging around it too. You know, I hear a lot of the program integrity arguments, but electronic data is arguably more reliable than a client statement. I can go and print a pay stub saying whatever I want for $4.95. I think it's probably cheaper nowadays. You know, like paper document can actually be falsified, and not to say that our clients do that, but just to say that electronic data is generally very reliable. And this idea that a client must sign a form saying that they have no income, or must self-attest to the fact that they, you know, didn't acquire life insurance in the past 12 months. That adds very little value to the process, and that's not really program integrity. So I think there's an opportunity to set the tone and set the goal for ex parte renewal, rather than the previous administration's focus on program integrity. So we'll see where that all goes.
And we received a follow-up question on the work number from Arizona. How would advocates go about asking the state to obtain the information through the work number? Because clients get frustrated as they struggle with technology and other issues, and companies won't assist them, only give them instructions on how to obtain through the work number.
Yeah, I mean, that's a conversation with the leadership to talk about what data sources are you using and why not. And I know Arizona has kind of a complex administration of SNAP and Medicaid, but I'm pretty sure Medicaid's in a separate system, so I'm not too sure why they're not accessing that through the hub. So I know they have some overlap, but it should be possible. So that's kind of a conversation. You know, it's in the hub. Why aren't you using it? Understandably, if they need a separate contract, the cost can be a big barrier, but just kind of better understanding what those limitations are. And it also could be that the state does have access to it, but at the caseworker level, they don't access it readily, or there's some limitation, and their default is to push the obligation on the client to go get this information rather than taking advantage of that electronic data. So I think just more conversations, and we'd be happy to support you in kind of talking through what some of those options are. So recognizing at time, okay, Melissa's asking about the CMS guidance. I wish there were some. It's informal. They've set it on calls, the CMS guidance on the zero income cases. We've heard it. There's an article out of a news article from ProPublica out of Idaho talking about how it's really restricted them in their renewal process and some other things, but it's sub-regulatory. It's something that they've instructed states about, but there's nothing physical to point to.
Yeah, she actually called me, the ProPublica reporter, to try to figure out what Texas was doing. I think she lives in Austin now. And I was like, I don't think we ever changed it. And I don't want to burst one thing we might be doing right.
Right. But a huge opportunity for some CMS action here. So we are at time. So I just want to thank you all so much for being on the call and for your participation. And just to reemphasize that we are available to work through this with you. If it's not obvious, this is kind of a passionate issue of mine, and it's just such a great opportunity to make sure that eligible individuals continue to receive benefits, and a win-win all around for folks. So if there's something that would help to talk through, would love to. And just a reminder, I am that one who sees the design documents in my sleep. So if you are able to obtain them, please share them with us. We would love to sit down with you and kind of work through where some of the opportunities are. So thanks so much, and we look forward to being in touch. Have a great day.